moment we landed, Hosh and Samesa reception committee was already there, so it was quite a feel. The countryside of San Pedro Sula was quite impoverished, although the natural beauty was something to behold. The closer you got to downtown, you started seeing some civilization, and you could see developments which were very similar to what we're used to seeing here in the United States. The purpose of our trip to Honduras was to interact with primarily surgeons in that country. Neurosurgery, spine surgery, and orthopedic surgery in the United States is done at a very different level than it is in countries outside the US. Some of the Honduran physicians had expressed interest that they wanted to come and train with us in the US, and our goal was to share our experiences, some of the techniques, some of the new technology that is being used in spine and orthopedic surgery. In the evening, we had a dinner invitation from a industrialist businessman who originally hails from Pakistan, the same country that I come from. So he is in the textile business. He was educated in California and finally came to Honduras to set up his business, and has done exceptionally well over the last few years. He usually travels in bulletproof vehicles, so the car that he sent over to pick us up in was also one of those special vehicles. We were his guests, and he hosted us to a 5-course wonderful meal. Had the occasion to see his beautiful house and his new beautiful bride, and had a wonderful evening. From San Pedro Sula, we traveled west into the mountains to head towards Copan, which I found fascinating. This civilization had certain characteristics which were very unique. They had homes, they had amphitheaters, they had playing fields, so their level of civilization was markedly advanced to what one would consider quite ancient. So Samesa Hospital is a private hospital in Honduras. They're doing good work, taking care of patients, and currently are in an expansion mode to expand their facilities not only within San Pedro Sula, the town that we were in, but also expanded to some of the other towns. They are setting up a new facility in Roatan, where most of the medical tourism occurs. Once that facility opens up, there might be an occasion to have a symposium where we can go and discuss this, similar techniques and something very similar to what we did in San Pedro Sula. This would be a catalyst for further trips where we can go and train those surgeons in those procedures, or at some point come over to the United States and perfect those techniques and go back and use them in their country.